Alright, biceps brachii has two heads. The short head attaches to the tip of the coracoid process of the scapula, and the long head attaches to the supraglenoid tubercle of the scapula. The long head runs through the intertubercular groove, and then the transverse humeral ligament covers it to keep it from popping out. Both heads then go down to distally attach to the tuberosity of the radius and fascia of the forearm via the bicipital aponeurosis. It has no attachment to the humerus. Brachialis attaches at the distal half of the anterior surface of the humerus, and then it distally attaches to the coronoid process and tuberosity of the ulna. Coracobrachialis attaches to the tip of the coracoid process of the scapula, and then attaches down to the middle third of the medial surface of the humerus. Pronator teres has two heads. First head goes to the medial epicondyle of the humerus, and the second is attaching to the ulnar coronoid process. Both heads attach to the middle of the lateral surface of the radius. Flexor carpi radialis attaches to the medial epicondyle of the humerus, and then distally attaches to the base of the second metacarpal bone and sends a slip to the third. Palmaris longus attaches to the medial epicondyle of the humerus, and then its distal attachment is the distal half of the flexor retinaculum and the palmar aponeurosis, and this is absent 12% of the time. Flexor carpi ulnaris has two heads. Humeral head attaches to the medial epicondyle of the humerus. Ulnar head attaches to the olecranon and the proximal posterior border of the ulna. The distal attachment for flexor carpi ulnaris is the pisiform bone, the hook of the hamate bone, and the fifth metacarpal bone via two ligaments, the pisohamate ligament and the pisometacarpal ligament. Flexor digitorum superficialis has two heads. The humero-ulnar head attaches to the medial epicondyle of the humerus, the ulnar collateral ligament, and the coronoid process of the ulna. The radial head attaches to the superior half of the anterior border of the radius. Both heads of flexor digitorum superficialis distally attach to the bodies of the middle phalanges of the medial four digits. Flexor digitorum profundus, which is under the superficialis, attaches to the proximal 3/4 of the medial and anterior surfaces of the ulna and interosseous membrane. Distal attachment for flexor digitorum profundus is the bases of the distal phalanges of the medial four digits. Flexor pollicis longus attaches to the anterior surface of the radius and adjacent interosseous membrane. Distal attachment for flexor pollicis longus is the base of the distal phalanx of the thumb. The deepest muscle is pronator quadratus, which attaches to the distal fourth of the anterior surface of the ulna. Its distal attachment is the distal fourth of the anterior surface of the radius. Done.